Welcome back friends. We will see the different types of parenteral routes as we have continued from the first video. Okay. So let's start with the first one, inhalation route. Volatile liquids and gases are given by inhalation for systemic effects. For example, general anesthetics. So what are the advantage? Quick onset of action. Dose required is very less. So systemic toxicity is minimized. Amount of drug administered can be regulated. Disadvantage: local irritation may cause increased respiratory secretion and bronchospasm. Now let's see second type, that is injection. Injection is a technique for delivering drugs by parenteral administration, that is administration via a route other than through the digestive tract. So types of injectable routes for drug administrations are intradermal, subcutaneous, intravenous, intraarterial, intramuscular and intraarticular. There are various other types also, but these are the very important. So let's start with first one, intradermal route. The drug is injected into the layers of the skin. So for example, in BCG vaccination and drug sensitivity test, it is painful and a small amount of drug can be administered. Second, subcutaneous route. The drug is injected into the subcutaneous tissue of the thigh, abdomen and arm. For example, adrenaline and insulin type of drugs. See, in the image you can see these are the various types of angles to administer the route of the drug for the specific type of injections. Second, for the subcutaneous, advantages are sub administration is possible. Depot preparations can be inserted into the subcutaneous tissue. So what are the disadvantages? It is suitable only for non-irritant drugs. Drug absorption is slow. Hence, it is not suitable for emergency condition. Now third, intramuscular route. Drugs are injected into large muscles, for example, paracetamol, diclofenac, etc. A volume of 5 to 10 ml can be given at a time. So advantages: absorption is more rapid as compared to oral route. Mild irritants, depot injections, soluble substance and suspensions can be given by this route. Okay. Disadvantage: aseptic conditions are needed. Intramuscular injections are very painful and may cause abscess. Self-administration is not possible. There may be injury to the nerves. D. Intrathecal route. Drug is injected into the subarachnoid space. For example, lignocaine, antibiotics like amphotericin B, etc. Next, very important route, it is widely used, intravenous route of drug administration. So drugs are injected directly into the bloodstream through a vein, and the drug administered as first is a bolus, the single relatively large dose of a drug injected rapidly or slowly into a vein. For example, IV ranitidine in bleeding peptic ulcer. Second, slow intravenous injection. For example, morphine in myocardial infarction. Third is the intravenous infusion. For example, dopamine infusion in cardiogenic shock, mannitol infusion in cerebral edema, fluids infused intravenously in dehydration. Now, what are the advantages of intravenous route? Bioavailability is 100%, quick onset of action, so it is the route of choice in emergency condition. Large volume of fluid can be administered. Highly irritant drugs can be administered to the IV route. Hypertonic solutions can be infused by intravenous route. Now let's see what are the disadvantages of intravenous route. Once the drug is injected, its actions cannot be halted. Means if by mistakenly any drug is given to the patient, you cannot remove the drug immediately. It takes lot of time to remove the drug, and at several conditions it can lead to a toxicity in the body. Okay. Next, local irritation may cause phlebitis. Self medication is usually not possible. Strict aseptic conditions are needed. Extravasation of some drugs can cause injury, necrosis, and sloughing of tissues. So, what are the precautions should be taken by the patient while administering the IV route or for the physician? Drugs should usually be injected slowly. Before injecting, make sure that the tip of the needle is in the vein. Next is a transdermal route. Drug is administered in the form of a patch or ointment that delivers the drug into the circulation for systemic effect. Example, scopolamine patch for sialorrhea and motion sickness. Advantage, self-administration is possible, patient compliance is better, duration of action is prolonged, systemic side effects are reduced, and provides a constant plasma concentration of the drug. And what are the disadvantages? It is expensive, local irritation may cause dermatitis and itching. Patch may fall off if it is unnoticed. There are various again injection routes which are not taken in the slides. These are intraperitoneal administration. So the drug is given into the peritoneal space. Advantage, rapid absorption due to the larger surface area. What is the disadvantage? It is very painful and risky due to the chances of adhesions and infections in peritoneal cavity. Okay. Next which we have intrathecal, that is intraspinal administration of a drug. The drug is given into the subarachnoid space. Advantages are the drug after diffusing from the lumbar sac spaces into the subarachnoid space bypassing the blood brain barrier, that is BBB, and blood CSF barrier, the significant levels are provided which otherwise are not possible by any other type of route of administration. Disadvantage, strict aseptic conditions and great expertise is needed to give such injections. Next is intramedullary administration. Injections are given into the tibial or sternal bone marrow. Advantages, onset of action is very fast as the vascular spaces of bone marrow communicate directly with the large vein. Disadvantage, it is very risky, painful, and strict aseptic conditions are needed. Then intra-articular administration. Injections are directly injected into the joint space. Advantage, it ensures the higher concentration of drug is in a localized area. So these are the various types of injections which are given or which are preferred for the route of drug administration. And you can see as in the diagram it is shown, intravenous is directly given into the vein, subcutaneous given in the subcutaneous tissue layer, intramuscular is given directly into the muscles. And in this diagram you can see these are the various angles of the injections which are given to the patient. Okay. Now, after this, there are various special drug delivery systems which are available. We will see one by one. So, these are the developed to prolong duration of drug actions and for the targeted delivery of drugs or to improve the patient compliance. First, Occusert. It is kept beneath the lower eyelid in glaucoma. So, it releases the drug slowly for a week following a single application. For example, pilocarpine type of drugs are administered through Occusert. Next is Progestersat. It is an intrauterine contraceptive device that releases progesterone slowly for a period of 1 year. Next, liposomes. They are minute vesicles made up of phospholipid into which the drug is incorporated. They help in targeted delivery of drugs, for example, liposomal formulations of amphotericin B for fungal infections. Then monoclonal antibodies. They are immunoglobulins produced by cell culture selected to react with a specific antigen. They are useful for targeted delivery of drugs, for example, delivery of anti-cancer drugs using monoclonal antibodies. Next, drug eluting stents, for example, paclitaxel releasing stents used in a coronary angioplasty, and computerized miniature pumps, for example insulins, etc. So these are the various drug delivery systems which we have seen in this video. Okay, so thank you. Here we have ended with the route of administrations, different types of route of administrations, their advantages and disadvantages. In next video we will see the pharmacokinetics, that is absorption, distribution, metabolism and excretion of drug from the body. Thank you.